This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko from the Acupuncture On Air program at Radio Hawke's Bay. This is where we interview acupuncturists from predominantly around New Zealand, but also from around the world. And we have interviewed people from Australia and America, but this is the first time we've got somebody from the UK. We've got our special guest, Dr Carolyn Eddleston, who is a medical practitioner and as well as a Chinese medicine practitioner. And we'll be talking to her predominantly about the treatment of menopause. But good morning, Caroline. So let's just say hello and see if everything is working on our radio show.
Hi, Heiko. Yeah, thank you for inviting me. What a privilege to be your first UK guest.
Yeah, that's right. Well, only the best for this program.
Of course.
Yeah. Now, as this is our sort of our first intro show, first I'd just like to introduce you to our audience. And I'm sure many of them will be interested just to learn, how did a registered medical practitioner have like a complete transformation and then end up practicing as a traditional Chinese medicine doctor? Did you, in the UK, did you go straight from sort of high school to university to medical school, or did you always have a sort of a calling you wanted to help people? Tell us a bit about your background there.
Yeah, so I remember being about 16 and not being a brilliant student, to be honest. So they always said to me, that you're not clever enough to do medicine. And I thought, well, we'll see about that. But to be honest, I sat with a primary school teacher. I did a bit of nursing. I remember sitting with a physio. So I sensed I wanted to do something with people. I was always fascinated by what made people tick, really. So I was quite interested in people, I would say, rather than illness. And then when my school told me I wasn't clever enough to do medicine, I thought, I'm going to sit in with a GP. And this was, a long time ago, 40 years ago or so. And it was a female GP, which was a family doctor, which was unusual in those days. And she just blew me away. I just thought, I went home and I said, that's what I want to do. So I was very clear from that age, really. And I think I talked my way into med school because my grades were so awful at exams. And back then they actually interviewed medical students, which they don't much in this country now. So I was very lucky, really.
It's a bit like, I think here, you have to get so many marks out of whatever that total of the NCA is, and that's it. If you don't get that, well, you can't get in. So...
Well, that's it. I'd never have got in now.
Yeah. Now, what about the connection between New Zealand and you? Can you tell us, Caroline, how did you end up in Christchurch and studying Chinese medicine?
Yeah, it's an interesting story. I remember having done all my medical training here. So you do 5 years at uni, then you do a year as a junior doctor, and then another 3 years to be a GP. So I'd kind of had enough by the end of that. I'd done a 2 years of being a doctor, being a GP in the southwest of England in Devon. And I remember seeing my life very clearly set up in front of me, the 2.4 kids, the Labrador, the four-wheel drive, the medical social life. And I just thought, this is terrifying. I'm not there. I couldn't see my way ahead. And I thought, there's got to be a bigger world. I've got questions. I had a lot of questions in Western medicine that nobody was really answering. So I remember turning around the back of a medical journal, which I hardly ever read, and saw an advert for a medical officer in New Zealand. So I literally picked up the phone very spontaneously, had an interview there and then, I think, was probably sitting in my pajamas in England. And they said, come across for 6 months, work as a doctor in an after-hours surgery in Christchurch. And that's actually how I ended up in New Zealand.
Oh, right, that's amazing. Now, what about, the acupuncture? How did you're working as a doctor in Christchurch in New Zealand, then how did you end up at acupuncture school?
So what happened is, because I was doing shift work, I was kind of free in the day, and I didn't know anybody at that time. I don't think I even had a car. So I was sitting in a cafe, and there was this flyer saying, come and learn about the philosophy of Chinese medicine, so yin, yang, Taoism. I thought, well, that sounds interesting. I didn't know anything about it. And I went along to this course, and honestly, light bulbs went on for me. I was listening to how they explained about how we're connected to the seasons, how our body works, and the philosophy fascinated me. And then this idea that they connected different organs within the body, I just thought it was absolutely fascinating. And I obviously looked quite interested. And the woman, Cameron, who was running it, sort of caught me at the end and said, "Who are you?" And I told her, and she said, "Brilliant, I need a Western medical teacher for my acupuncture college that I'm setting up." So I sort of got talked into this course. In fact, it turned out the course hadn't even been developed, so I ended up developing and teaching Western medicine to a bunch of acupuncturists. So that's where my journey started, but I was teaching them Western medicine, which is funny.
So then you were teaching them the anatomy and all those things, and then learning the Chinese medicine as well during the day, and then still, doing night shifts in the hospital. So pretty full on.
Oh yeah, well, it was a bit. I was paying my way through. Well, I taught, and then after 18 months, I thought I'm more interested in what they're learning than what I'm teaching. So I gave up that and sat in the classroom and became an acupuncture student, as you say, and just paid my way by doing the odd bit of shift work as a doctor. So it was quite a life-changing for me. That was 3 years full-time.
And then, of course, as fate had it, then you went back to the UK, and then what happened when you went back? Did you set up straight a Western medical practice, or did you just tell us a bit about what happened when you went back?
Yeah, when I went back, I found it quite difficult because I knew that I couldn't not do acupuncture. So I trained. Of course, I'd always been employed before then, so I needed to learn how to run a business. So I took about 6 months while I was I did some locum work as a GP in one practice actually. And then while I was doing that, I set up my own business. And, as you start a business, you're very, very quiet. So I was very lucky because I could do the two alongside. I couldn't do them together. So I was working in the NHS in England where healthcare is free, and then setting up a private acupuncture clinic. So I was doing both alongside for, 15 years or so.
Okay. And now I hear that you're moving your practice again, and what's your sort of plan? Are you going to be on your own, or are you going to have other doctors or other practitioners, or what's your sort of goal there?
So I started life as an acupuncturist in a tiny room in an osteopathic clinic here. Then I expanded and moved to half of our house. So there are now a team of 3 of us. And what I want to do is move the clinic away from the house to its own separate place. So I've found a great new building where there will be 4 of us, only 2 treatment rooms. So I don't want it to get too big. I quite like the idea. I've always had a practice where we're all singing from the same song sheet. We're all traditional Chinese medical practitioners, which I like because we can cross-refer, we can talk in the same language. I mean, in the ideal world, I would love to have an integrated clinic, but I don't find many GPs who are actually working in the way I like to work. So I still use my Western knowledge, but really we are traditional Chinese practitioners now. So we have somebody doing Chinese massage, tweener. The one thing we're missing, Heiko, if you ever want to come over, is herbs.
Okay. Yes. Yeah, well, maybe I can. I've got plenty of years ahead of me, so yeah, I can still come.
Yeah, exactly. Yeah.
Now, in some of our future shows, we want to be talking specifically about acupuncture and its role in menopause management / treatment, and how it can treat symptoms like hot flashes, insomnia, depression, and there's a whole bunch of different symptoms that as women can experience through the perimenopause and the menopause frame. But I just want to ask a couple of questions about you marrying the 2 modalities together, because you will have that knowledge of your Western medicine, with blood tests and hormones and enzymes and things like that. And, I know in my own private clinic, in most cases, patients come in and they've already been and had a Western medical diagnosis or been given a label like, oh, you have / irritable bowel syndrome, or you have clinical depression, or what you've got's coming from a virus. But then I asked the questions and diagnosed according to my own traditional sort of diagnostic concept. What about you? How do you sort of approach your patients now? Do you sort of do half and half, or do you back it up with blood tests, or just tell us a bit about that?
Yeah, well, it's interesting. What I never wanted to be was a private GP, so I'm very clear that now what I do is people come in that wouldn't normally have acupuncture because they're reassured because of my medical background. So that goes in my favour, because what tends to happen is people do two things. They come in, they often have quite complex medical problems, and they're relieved that they can talk about drugs and things, but I quickly get them off that. So what I do is I have a safety netting thing in check, whereas my GP hat's always in the background. So if I'm concerned that they need investigating and they've got something seriously wrong, that's the first thing I do. I said, I'd like you to get this blood test and this blood test. Go and have that looked at because I want to rule out something nasty, then come back. Or, somebody we're having real problems with the NHS in this country, that people just can't get to see their doctors. So, I'm actually... It's
the same over here, yeah.
Yeah, I'm having to listen to people's chests and actually walk somebody into a kind of emergency care place the other day with that problem because they needed more. So I still think for life and death stuff, there's no doubt that Western medicine's great, but really for everything else, I can do a lot more with Chinese medicine without a doubt. So it's reassuring for people. I've got that in the background. I'll sometimes see somebody's mole and say, look, you need to go and have that checked. And that's great. But actually, I'm not doing Western medicine. I'm very clear about that. I can advise them and send them off to other places, but I quite enjoy not having that piece because, to me, health is so much more than that, and I find it more encouraging I can do more with Chinese medicine without
Are the patients coming to you and expecting acupuncture and sort of an alternative treatment, or are they sort of like, oh, she's a doctor, and then she might give me a drug or she might give me a needle? Sort of.
No. So what I do is I keep them. The only thing I offer that's medical is what I call a holistic medical consultation. With people want time to discuss their medical issues, I can look at the evidence and go, this is why your doctor's telling you to go on a statin. However, here's other alternatives you can use, and I keep that a little bit separate. There's a little bit of overlap because people say, while I'm here, Carolyn, can you have a look at this? But actually, they're coming to me for I have a whole different conversation around health with my Chinese medical background, yeah.
See, I know with my own practice, I get a real mix of patients, and for example, I get some, they've either found me through the internet or through they've, spoken to someone and they've come in and they want to change their PSA level or they want to change their ALT levels in their liver. And it's like, and they want to do it with something natural, sort of like, instead of taking this drug, can I just give them this herb or do this thing to change this blip on a blood test? And then I sort of say, well, that's not really what I do because, what I'm finding is that patients, they need to actually to feel better as opposed to just like, changing a blood test.
Yes.
And some are not interested in that. It's just sort of like, I just want to change the cholesterol level. I don't care what I feel like or what I look like. What about you? Are they coming for alternative treatment to Western medicine, or are they just sort of coming just to feel better, or what's happening there?
I think for me, and I don't know whether this is because of my medical background, I get a lot of people who've tried everything. So either they've got a really complex medical history and Western medicine doesn't know what to do with them, or they feel really ill. They've had tons and tons of tests. This happens a lot. And all the tests are normal and they feel awful. And that's a really good place to start, I think, because they're confused and they're desperate. And you can actually start to talk about exactly what you said. Doesn't matter what the tests show. That's not actually an indicator of health. They're pretty unsubtle tests.
Yeah.
If your blood test changed, a lot's been going on before that. So I Yeah, I think I'd say there's a whole spectrum, isn't there, of people that come in. Most people that come in with a specific thing, by the time they've had a few treatments, they realise they're feeling better anyway.
Yep. Listen, we're just about out of time, Caroline, so listen, thanks very much for coming on the show, and we look forward to our future shows, in particular the next show where we're going to specifically be talking about heat flashes in relation to in menopause and what acupuncture can do. And I'll put your, and these shows will get put up onto YouTube, so I can put your details about your clinic and everything onto there. So, okay, we look forward to seeing you then on the next show, Caroline.
Great. Thank you very much for inviting me. See you soon.
Okay. Thank you, everybody, and we'll see you on the next show.
This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.